nurse at the health department now for, oh my goodness, my second one is 24, so about 23 years. And I've kind of worked through lots of different programs while I've been there, and currently I'm working with our immunization program is one of the hats that I wear. Nobody at the health department wears one hat, so I'll change that one, and that's what we'll be talking about today. So Carrie did kind of challenge me a little bit because I primarily do infants and children for vaccinations, and I have a broad knowledge of adult immunization, so she did kind of push me and challenge me a little bit to kind of look at that stuff a little bit more and just kind of refamiliarize myself with it so that I could get the best information to you guys. So most people incorrectly assume that childhood vaccines will cover them kind of for the rest of their lives. The problem with that thinking is that some adults were never vaccinated as children. Some vaccines that are available now were not available, especially as we get older. They weren't available when you guys were children, and even when I was a child, because I'm quickly becoming one of those older adults, much to my parents' chagrin, because that makes them even older. So, so that's my mom and dad right there. So some of those vaccines were not available when we were kids. Immunity can actually fade over time. So we get those initial vaccines when we're children, and then as time goes, it kind of goes away, and that's why we have to get those boosters and that type of thing. And then there's an increased risk of serious disease as we age caused by some of these diseases, just because our immune systems aren't as good, other underlying health conditions we may have, that type of thing. So I will apologize, Carrie and I had some technical difficulty communication, so this isn't my actual presentation, but we're going to be able to use it. So if I'm a little flustered, that's why. I'm just trying to get into everything into place with what this one is saying. So what do vaccines do? Vaccines actually prevent you from diseases, and many of them are infectious. Some of the vaccine preventable diseases that you guys may have heard of, or and at your ages may have actually seen, are things like tetanus, diphtheria, whooping cough, polio, pneumococcal pneumonias, and meningitis. There's something called Hib. It's a meningitis caused by a different bacteria. Measles, mumps, rubella, chickenpox, hepatitis A, hepatitis B. There's a couple different meningitises, ACWY and B, and then human papillomavirus, and of course flu and COVID. Vaccines will help to prevent disease, but more importantly, I think it does help to prevent those that you may come into contact with that have not been vaccinated. So it's not just about protecting yourself, it is about protecting those around you. So we think about very young infants, those under 2 months of age that cannot get vaccinated yet. We also think about people with certain medical conditions. So some medications lower immune responses. So if we are all vaccinated, it helps to protect them if that disease process comes into, into the county or into our communities. People who have had bone marrow transplants, people around chemotherapy, all of those types of things help to decrease that immune system, and that if we are vaccinated, we're going to help prevent those people from getting more sick. Like I said, the effectiveness of vaccines can vary by the vaccine itself. It can be dependent on the person's age and also that health of the person. A lot of the diseases do have complications related to them that people may not necessarily think about. So if we think about shingles, and most of you probably know what shingles are, may have even experienced them yourselves, but shingles is caused by having chickenpox as a child, and that disease kind of lays dormant in your system, that virus, and for some reason, it rears its ugly head. That causes this painful nerve rash that can actually last on average about 32 days. It can actually last months though. And some people can have long-term kind of pain for years because of that. Many of you lived through the polio issues. Those polio can actually have long-term effects, something called post-polio syndrome, where there's weakness and fatigue in the muscles. There might even be loss of muscle and muscle function. My mother-in-law has post-polio syndrome, and she's got some of that fatigue, but then she just has some more aches and pains and stuff because of the way the polio had kind of set in. Although if you would look at her, you would never know that she had polio and that's what's going on. Meningitis can cause things like loss of hearing. People have lost fingers, toes, hands, and feet because the way that it affects the body. Rubella. If a woman is exposed to rubella while she is pregnant, it has devastating consequences for that fetus that she's carrying. So those babies will be born with brain damage and cerebral palsy. Hepatitis B can lead to liver cancer. And then one you guys may not be real familiar with, it's HPV or human papillomavirus. It is actually the leading cause of cervical cancer in women. And we are also seeing some head and neck cancers also from that. So all of these diseases, we're looking at, yes, the disease process itself and what it does in the immediate term, but we're also looking at some of those long-term complications that there may be also. And getting those vaccines can help to decrease those. Infants can start vaccinations at 2 months of age, as early as 6 weeks. Unfortunately, in our county, we don't see that. We actually probably have the lowest, we do have the lowest childhood vaccination rates in the state, and probably some of the lowest in the country. People that are getting them seem to delay them a little bit here too, although we have a large population that does not vaccinate at all. One of the things we talk about in public health a lot is that when public health works, nobody notices it and doesn't appreciate it. So I think this pandemic has kind of brought that to the forefront that, oh gosh, public health really is important. And we have to we have to think about it and making sure that infrastructure is there. However, I think the same thing is with vaccines. When vaccines work in our community, what happens? Nothing. Because the vaccines are working and we're preventing those diseases from getting into the county, we're preventing people from getting sick or getting sicker than they would with a vaccine. And then, we are preventing some of those complications from happening. I think a lot of times, that especially with, maybe your children, your grandchildren, what we see a lot right now is that because people have never seen many of these diseases, they don't think that they're a big deal, and the vaccines are starting to almost be demonized themselves. So these diseases are not something that are a thing of the past. They're happening, and we still see them all the time. So a few years ago, Angelina Jolie had chickenpox. I don't know how old she is, probably in her 30s, 40s maybe, I don't know. She had chickenpox. I have no idea what her vaccination status was, I don't know. But National Hockey League, actually in 2014, they had 24 players that contracted mumps. In 2017, they had 8 players that contracted mumps. Disneyland, I don't know if you guys heard about this outbreak at all. It was actually in 2014 also. One person started that outbreak, and just to kind of give you an idea how quickly that stuff spreads. In that one person from Disneyland, we had 131 cases in California. We had 16 cases in 6 other states. There was 159 cases in Canada and at least 1 case in Mexico. So, you know, it can be far reaching with just 1 case. 2014, we had the measles outbreak here in Ohio. Knox County is kind of where it kind of centered around, although we did have cases here in Holmes County too. We gave over 6,000 measles vaccines in 2 months here in this county during that outbreak because people were unvaccinated. There were, polio is still very active in areas like Pakistan, Afghanistan, Nigeria, Ethiopia. I like to tell families when they bring children in, if they are refusing some vaccines or not getting vaccines or whatever, that this stuff's a plane right away. Especially in our community where so many people are doing mission work, where so many people are traveling across the globe. If you are not vaccinated and you're going to those places, you easily can be infected, bring it back, and we're going to kind of, you know, blow those diseases up in this county also. I kind of looked at our statistics. In 2021 and 2022, we have already seen in Holmes County cases of mumps, Hib, whooping cough, pneumococcal pneumonias, and meningitis. So they're here, we're seeing them all the time. Hepatitis A is kind of really increasing at this point. We've got some hepatitis B cases also. So they're here, we just don't see a lot, or we just don't hear a lot about them, I guess I should say. So when I start talking to parents about the vaccines their kids need, we will talk to them about, you know, what they have had, and they're like, well, we had our shots when we were a child, we really need vaccines now. And I think the reason is just because they just don't know that they need them. And unfortunately, I think healthcare providers are not always the best. Sometimes the physicians are not really the best about talking to kind of the middle age about vaccines that they may need, or those middle-aged people just aren't necessarily going to their doctors a lot either. So I think we're good about talking about childhood vaccines, we're good about talking about your age groups and vaccines, but we kind of miss this group in the middle. I think a lot of people have not heard that these vaccines that their children are getting also those diseases can still affect us as adults. They think of them as just childhood and not looking that they affect adults also. Just as, let me see here, I'm trying to throw things in here. So, just for an example, in pneumococcal disease is what causes the majority of pneumonias in people 65 and older. In the US, we had, in 2013, there were almost 34,000 cases of pneumonia in the US. 90% of those deaths were among adults. In 2015, there were 21,000 cases of whooping cough, and about 25% of those were among adults. So, you know, those are just, we're not necessarily hearing about that they are affecting adults, but they do. Vaccines are needed to protect against those diseases we talked about. We talked about the childhood vaccines may not last, and that there are other diseases that adults may be at risk for because of their age, their occupation, their lifestyle, health conditions, and where they travel. I think when we look at just some basic immunizations, that we have to look at the complications that may come from the diseases that you're exposed to. So With flu, people know they can get pneumonia from flu, and you know that flu can make you very sick. However, your heart attack risk increased by twofold when you have the flu. So there's these little pieces with these diseases too that we may not think about that can really affect our lives in other ways too, or kind of perpetuate other disease processes while we're there. Ashley had talked a little bit about your immune response decreasing as you age. And again, that is going to put you at increased risk for these infectious diseases and for those complications that come along with it. So this is just kind of a list of the adult vaccines that there are. Again, what you need is going to depend on what you've already been vaccinated for, your age, your medical conditions, where you travel, your occupation, those types of things. Vaccines recommendations do change over time, and that's just because vaccines are developed. It could be because a company decides to no longer make a vaccine. The vaccine world is not one that's hooked to a lot of money, so a lot of manufacturers don't even want to get into it because the money's not there. So they may phase out some vaccines. They may find over time that the disease process is changing itself a little bit, and they may have to change that vaccine. Flu is one of those. That flu vaccine will change kind of yearly. The last couple years it hasn't changed a whole lot, but they may change it, you know, kind of just like that. Or they may find that over time, the immunity is not lasting with a vaccine, so it will be changed, or the recommendation to get different boosters and stuff will change along with that. One of those recommendations that has changed recently is for shingles. Up until 2019, 20, 21, those years all run together for me being pandemic years. There was just a single dose Zostavax. I want to say it was maybe 19. That changed. There's now a 2-dose called Shingrix. So it used to be you just needed the 1 dose. Now the recommendation is that you get that 2-dose even if you had the 1 dose, because it just doesn't last as long and work as well. The pneumococcal, which is the next one down on that list, again, that's that one that causes pneumonia for us. It usually had 13 different strands of that pneumococcal in. This year they came out with one that is it's called Prevnar. It's Prevnar 15 or Prevnar 20. So the recommendations will be that Prevnar 13 is no longer used for older adults. It will be 15 or 20, but you don't have to kind of repeat that. If you had the 13, you don't need to get the 12 or the 15 or 20 anymore. So, kind of the recommendations are that all adults need that flu vaccine every year. Recommendation typically is that you get that looking in October, end of September, really not before then. You will see Walmart and pharmacies start advertising those in July, that they've got flu vaccines available, or August, that they've got flu vaccines available. The problem is that vaccine, the effectiveness of it starts to really dwindle at about 6 months. So if you're getting that vaccine in August, September, October, November, December, January, February, right as flu season is really hitting, your effectiveness of that vaccine is going away. So waiting until October or so to get that vaccine every year is going to help you more. Tetanus, which is TD, or Tdap, which is tetanus, diphtheria, and whooping cough. We should have one of these every 10 years. It used to be that, oh, I just need to get my tetanus updated every 10 years. Now, the recommendation is that we get that Tdap. We get that piece that has the whooping cough in every 10 years. I think they're still making TD, but not many places are carrying it. That whooping cough part, especially in our county, whooping cough is always here. The immunity starts to go away after about 4 or 5. It just keeps decreasing. So if we're boosted every 10 years, we're gonna have that whooping cough protection. Now, whooping cough for you and I are not gonna be what it is in an infant. With an infant, you know, they call it whooping cough because they get that, and then they cough, and then they cough, and they cough, and then they throw up, and then they break ribs, and it's awful for these little ones. For us, it's just gonna be this constant, persistent cough that we can't get rid of. But then we're passing it on to these babies. So you may have had grandchildren, great-grandchildren lately, and that mama's saying, have you had your whooping cough booster? And if you haven't, you're not gonna see my baby until you do. There's a reason for that. Try not to fight them on it. Get your whooping cough booster, because that will definitely help. They also do recommend, I know none of you guys have to worry about pregnancy at this point, but they do recommend that pregnant women get, I know, Dad, you do. We worry about you all the time. We do recommend that they get a Tdap booster with every pregnancy, because what that does is it increases their immunity, and while they're pregnant, it passes that immunity onto that baby. So we get some extra coverage for that baby until they can start their vaccines at 2 months. Zostarvax, this is an older slide. So Zostarvax used to be needed at age 60. When that new one came in, it actually got lowered to age 50.
What is Zostarvax?
So Zostarvax is the one for shingles. Sorry, thank you. It's the one for shingles. It used to be age 60, now it's age 50. And then the pneumococcal vaccines, they do start those at age 65 now. They've just changed a little bit what they are. And then again, you know, just talking to your physician to find out of all those other vaccines, which ones do I need based on what I do. You know, if you're still in the nursing field, you probably, you know, you need a hepatitis B. You know, may need some other ones. If you're going to be traveling to, you know, Jamaica, we go to Jamaica every year. We all have our hepatitis A vaccines because hepatitis A is very prevalent in Jamaica. We want to make sure we're covered. So just talking to your doctor, figuring out what you need so that you can make sure that you're covered and safe.
But the shingles and pneumococcal are just a one and done thing.
So shingles is,
it's a two-part.
correct.
I mean, once you've done
correct.
that, you don't
Once
need to
you've
do
done
that
it, you've done it. You don't need to get boosters.
Same way with the pneumococcal.
Same way with the pneumococcal. There's
When did the chickenpox one start?
good question. So the chickenpox vaccines, we can give those at 1 year of age is when the first dose is, and then that second dose is before they go to kindergarten.
But when did it come out?
1994 or 95.
I have a question about that. If they have their chickenpox vaccine, can they not get shingles then? Okay, are they protected for shingles?
So the research is looking that there is a much lower risk of shingles down the road if they have had their chickenpox vaccine, correct. But yeah, I think it was like 1994 or 95.
Well, my kids were born in the 60s. My son had it, and my daughter never got it till she was like 22.
Yeah. So if we see, so what I see with childhood immunizations now, many parents in this county do not do chickenpox vaccine because they feel it's just this benign kind of, you know, rite of passage as a child, you get it. I looked at it as a working mom that was busy. I don't have time for y'all to get chickenpox. And 2 weeks later, you all get chickenpox. And 2 weeks later, you all get chickenpox. And 2 weeks later, you all get chickenpox. That's, you know, 8 weeks. I don't have time. So I kind of look at vaccines a little bit different sometimes, I think, as a working mom with that stuff. But with those parents, if they don't do that, if they don't do the chickenpox vaccine, when they come in for their 7th grade shots, so has Johnny had chickenpox yet? Nope, just hasn't. Well, now's a really good time to do it because the older they get, the more sick they get, and oftentimes we can kind of catch them and get them to do it then. And we are seeing more and more of those kids that aren't getting chickenpox because more people are vaccinating and it's working.
But like 40-year-olds, you aren't vaccinating.
If you have already had chickenpox, absolutely you do not need it. Chickenpox is one of those diseases that pretty much once you've had it, you're never gonna get it again. Once you've been vaccinated, you don't need to get revaccinated. But
Shingles.
then they're gonna have to get they have to get that shingles booster at 50, or that shingle shot at 50. Correct, so yeah, at 50.
Oh, is most insurance covered now?
Yes, because it's now been, it's American Academy of Immunization Practices approved, so insurances will cover it at age 50. I was thinking something else along that so some diseases like chickenpox, like measles, mumps, once you've had it, you don't need to get vaccinated, you're not gonna get it again. Things like whooping cough, you can get again. Things like pneumococcal meningitis, or pneumococcal pneumonia and meningitis, you can get those diseases again. That's why that vaccine's important to help prevent those.
I don't ever remember having shots for meningitis. I thought that's just something they did for teenagers, like probably, I don't know how long ago, they started giving the kids in junior high school.
Right, that's that ACWI, correct. Yep, they do that at 7th grade, and then again, it's age 16.
Okay.
The Prevnar, which is a pneumococcal, and the Hib are the ones that we give to infants. And I can't tell you for sure what years those started, but I never had them.
But we don't have to worry about meningitis, the meningitis shots.
The pneumococcal is the one, and that's like for pneumonia and meningitis.
Oh, okay, it's
Yeah.
together.
Yeah.
Okay, well, I just never.
Yeah, the
Okay.
pneumococcal can actually cause blood infections. That pneumococcal bacteria can cause blood infections, pneumonia, meningitis. So you get 3 bangs potentially for one bacteria.
We got it, but we just thought it was for pneumonia.
Pneumonia, exactly.
Okay,
And that's
alright.
what most people will call it.
Okay.
Most people will call it the pneumonia shot.
Okay,
For some reason, pneumonia doesn't scare parents of little ones either. So I talk in terms of meningitis because that seems to scare parents more, and they're more apt to think about the vaccines that way. So yeah, pneumonia vaccine is what you're typically looking at and thinking about.
Can you get shingles more than once?
Yep.
How many times can you get it?
Numerous.
You can get it as many times as your wonderful body wants to pop it out.
I had the weak one, shingles shot, never had the new two.
The 2, yeah, they recommend the new 2, just because that first one wasn't working quite as well and didn't have the longevity. So yeah, they still recommend that 2 dose.
But I heard that they don't pay for the new one.
They should.
they do at Walmart.
Yeah.
They do.
Yeah.
They
do at Walmart.
percentage.
Yeah.
It may have
I
been.
had $100 deductible.
I was gonna say it depends on what your insurance. I mean, how your insurance pays. But once vaccines are approved by, they call it the ACIP, which is the American Academy of Immunization Practices. Once it is approved by them, then insurance is required to cover it. Depending on your insurance coverage will depend on what, you may or may not have to cover for that. And that's just all the different insurance idiosyncrasies of things.
Going back to the mumps, is there a shot out for the mumps?
Yeah, it's that MMR, it's measles, mumps, and rubella. So mumps is one of those, once you've had mumps, you're not gonna get them again.
Yes, you do. My aunt had them 3 times,
Really?
and 3 different places.
Yeah, typically it's once you've got them, you've had them.
Yeah.
And you're not gonna get them again. So measles, mumps, and rubella is typically a 2-dose series, and that is kind of that age 1 and age 4 or 5. Again, that's when they're done. Now, in that measles, mumps, and rubella, the mumps part is the one that our bodies don't necessarily create the antibodies to at the same level. So it's the lowest part of that. So if there's a mumps outbreak, people can get a third shot. So a lot of times when mumps are in like college campuses and stuff, they will get that third one just to boost
I
them a
know
little
she
bit.
had them 3 times and she was elderly. She was, you know, I mean, she wasn't young.
So, and there could have been issues then, you know, with her immune system and those types of things that would have made her more likely to get them again.
Okay.
Yeah. So we talked a little bit about, you know, getting immunized doesn't just protect you, but it does protect those other people in our community. So you guys getting your whooping cough booster helps protect those little babies to not get whooping cough. I will tell parents that the pneumonia shot you get, we give that to infants. That's the meningitis one I talk about. That, when we can protect our babies and our children to not get pneumococcal, they're helping to prevent grandma and grandpa from not getting pneumococcal pneumonia also. So there's kind of that give and take on both ends of the spectrum there. And then, like I said, there are some newer vaccines out. Some of them are just for like adults and teens. Shingles is one of those, and then that HPV, that cervical cancer vaccine, that is one of those other ones. Those are not childhood, those are strictly kind of older kids and adults.
Well, that one you were just talking about, that's mostly for teenagers, isn't it?
We started at age 11. So
So us older ones don't get them, do we?
you don't have to. I mean, again, but that depends. So if you and your physician feel that you are in a risk group for HPV, meaning you're having unprotected, unmonogamous intercourse, it may be, I mean, I think we could do it up to like age 45 right now, but yeah, so your age group, no, but there may be a 40-year-old that may be a possibility for, just depending on what their lifestyle is like. I talked to you guys about, you know, me being too busy for my kids to be sick, and I think as adults, we often are too busy, and we don't want to be sick either. So vaccines help to prevent us from getting sick, and having to take away from other responsibilities, activities, and travel, things that we really want to do. And then, you know, like as we age, then some of these vaccine preventable diseases we just get more vulnerable to. We're living longer than we've ever lived before, so this blows my mind because I'm quickly becoming one. 1 in 5 Americans will be 65 by the age of 2030. That's mind-blowing. So, we've got those risks with the immune system as we get older. And then vaccine preventable diseases are expensive. I don't think I have it in here, but, so I did look up some of those numbers. When we look at flu, (81% of those cases, and this was in 2013, 81% of the cases of flu in the US were in those over 50 years old. Of that 80%, 77%, so 2/3 of those numbers were over the age of 65. That was $16 billion in medical costs. When we look at pneumonia, 6% of the cases are in those over 50. We're talking about another 5 billion. Shingles, 9% of the cases are in those over 50. We're talking another $5 billion. And whooping cough, 4% of those cases were over 50, and we're talking about 4 million. So there's a ton of expense with just treating these medical conditions. Those were in 2013 dollars, so I can't even imagine what those are in 2022 dollars. Not only do we have that medical cost to deal with, but we've got missed work, you know, they can add into there also. Vaccines are safe. They're studied extensively. Most insurances do cover it. We kind of talked about that. Again, how much you have to pay for it will depend just on those different insurance policies. And like Ashley had talked about, you know, diet and exercise are really important to keep that immune system healthy and keep you healthy, and vaccines are kind of the same way. It's just one of those extra little layers that we have that can help to keep us healthy. So, influenza, flu. We're looking at anywhere from 3 to 50,000 deaths a year and more than 200,000 hospitalizations. Whooping cough, more than 28,000 cases a year. Infants that are exposed to us infected adults are at greater risk of death. And then that pneumococcal disease, 40,000 cases and about 4,000 deaths in 2010. And again, most of those are in those 65 and older. Shingles, over a million cases a year. Hepatitis B, which is a liver disease that is spread by blood and body fluids, that can cause liver cancer, liver cirrhosis, and there's about 35,000 cases a year. 90% of those are among adults. We are seeing increases in things like hepatitis B and hepatitis A, mainly because of drug use. But that doesn't mean if we're not using drugs that we're not at risk. Hepatitis B, like I said, is spread by blood and body fluids. So if I go to a restaurant today and I pick a hangnail or whatever and I bleed on the table and I just wipe it up with a napkin, that virus is actually gonna live on that surface for 5 to 7 days. So you come along, you're on the table, you've got a hangnail, you now potentially have been exposed. Hepatitis A is another liver disease that's spread through fecal matter and emesis. People may not even know that they have hepatitis A, but if they go to the bathroom, they don't wash their hands well, they then prepare your food and you eat it, or they open the door and you come behind them and touch it and then throw gum in your mouth, you're potentially exposed. So even though you may not be in those high-risk lifestyle categories, some of these diseases can, you know, be an issue with the potential exposure. Don't worry about that.
So you talked about the table, even if the table's washed?
If it's washed with bleach water,
Yeah, unless they use a disinfectant of some kind.
bleach,
Okay.
yes. And most, if you watch them clean tables,
Yeah,
and,
they
you
don't
know,
use
they
bleach.
wipe them
Yeah.
off. I mean, there's, you know,
Yeah,
they may spray them with something, but it
Yeah.
doesn't sit long enough to clean
and
stuff.
sometimes they use a little bucket of water that's used on 40 tables.
Correct. Yep, absolutely. So what can you guys do? I think it's important that we have to set a standard as a community that vaccines are important and that we're getting vaccines. So, talking about it. I don't like talking about vaccines. It makes me uncomfortable. It makes me uncomfortable because I don't know what the other person's thought is, and I don't like that confrontation. So it is hard for me, talking to you guys, it's fine. But if I'm talking to parents who don't like to vaccinate, it's hard for me to do that because it's really hard to negate the bad information that's out there about vaccines. So, I try to do it, I try to find that common ground, I try to find something that we can get that information across. But I think it's important just as adults that we talk about vaccines, and if, we talk to our kids, we talk to our grandkids, why the diseases that you guys have seen are horrendous. We don't know because we haven't seen them, thank goodness, because the vaccines work.
So being in public health,
Mm-hmm.
and this is not meant to push
Yeah,
anybody's
no, it's
buttons or anything, but I understand some people have religious reasons for not vaccinating. Okay, supposedly. But can you give me any other, other than bad information, is there any other, what other platforms are they trying to stand on, I guess is what I'm asking.
So, people will use religion
I know.
a lot. However, there is no recognized religion that says we should not vaccinate. It is more a philosophical, I don't believe in vaccinations. I think they're more harmful than they are good. That's what we see. So a lot of them,
But are they more harmful than good?
no,
That's right.
they are not. So a lot of it is, well, there's aluminum in vaccines. There used to be. Most of the vaccines have taken aluminum out. And the ones that have aluminum in, that's one of the things that helps for the body to work to make the immune response that it needs.
It's there for a reason.
Right. There is more aluminum in a can of green beans and in a formula container, and in that formula that baby drinks, than they would ever get from every vaccine that they would ever need in their lifetime. So we hear that a lot. We just don't know what's in them.
But they eat processed food.
Yeah.
Correct. Correct. So those are the things that makes it really tough for us to try to get around that bad information, because the people who are anti-vaccine are very good at pulling on those heartstrings of moms to say, well, do you want your child to die? Because, there's this one child who, and as a parent, absolutely, I'm gonna question everything I do for my kids. And what's right and what's wrong, and what are the pros and cons, and I'm gonna question that. And if I see all this anti-vax stuff that's what they're pushing, I'm gonna potentially question, is this the right thing to do? I don't know anybody who's ever had tetanus. I don't know anybody who's ever had hepatitis A. Is it really that big of a deal?
I had whooping cough when I was 7 years old.
Oh, we have
And
whooping
it-
cough all the time
It
here.
was horrible.
Mhm.
So I tell people that, part of it during the COVID thing, we don't need vaccines. And I said, I had whooping cough, I wish I would have had a vaccine.
Yeah.
And, I remember working every year when they offer flu shots. Oh, man. It's like, I'm not getting that, I get sick when I get the flu shot. What, don't get the flu shot.
Yeah,
And
and-
then those people end up sometimes missing a week's work.
Right,
Because they were sick.
'cause they had the
and
flu,
were out
yeah.
because they were sick, but it's like,
And that's,
yeah.
and there is some of those misunderstandings
Yeah.
too, that, these vaccines will make you sick.
Yeah.
You have a normal immune response. I mean, I look at, if I get a vaccine and the next day I feel a little wonky,
Yeah.
I'm like, ooh, okay, my body's doing what it needs to do, that's a good thing. I would much rather, you know, if you think about COVID, I would much rather feel cruddy
Yeah,
for 12 to 24 hours than to feel cruddy for a week or dead,
exactly.
you know, so.
Yeah.
Yeah, some of it I think is just a real misunderstanding, and then just having bad information that really plays on these moms' hearts, I think.
Well, I know my brother says about the aluminum, I'm gonna tell him about the green bean, can of green beans.
Yeah, well, I mean,
Yeah. that's
apple juice
Yeah.
has huge amounts of aluminum.
Yeah.
Yeah, I mean, if you look it up, it's there. It's really hard. Someone who is very anti-vax, it's hard to have a rational discussion about it, and to get the information across.
And the funny thing is, like some of our family members not doing the vaccines. We got vaccines when we were kids, it didn't kill us, it protected us. It's like, you can't convince them that they worked then, why wouldn't they work
Right.
now? It's like,
We weren't smart, and our parents weren't smart.
Well, you know,
Now
some of,
everybody's got a college education.
Yeah.
for everything.
well, and some of
And the
the
internet.
some of the
Yeah,
other
and the
stuff
internet, yeah.
is, you know,
Yeah.
there was one really bad study done about MMR vaccines and autism. You guys have probably all heard about it. Showed that it linked it to autism and, you know, whatever. Since then, that vaccine or that study has been debunked, and he has admitted to forging data to get the outcome that he wanted to show this. It has been repeated thousands of times. We know that an MMR vaccine does not cause autism. However, that information is still there. And even though he's lost his medical license, you can't, it's out there.
Yeah.
And it's hard to kind of get around it.
Was hepatitis B, was that the new vaccine that they got for the hepatitis? Or is that an old vaccine?
Hepatitis B's been around for a while. Hepatitis A is a little newer.
Okay.
And there is some newer hepatitis C treatments. It's not a vaccine, but some C treatments. So that could be what you've been
Is
seeing.
that the one they take the pill for?
That's hepatitis C.
Okay.
Yep.
I got the wrong hepatitis.
Yep.
So
Yeah.
what's the cause of the C?
Blood transfusion.
I think it's blood. I think
Yeah.
hepatitis C is through blood also.
Blood.
So we see have a lot of hepatitis C a lot with our drug users, with our IV drug users, and needle sharing.
Well, I know back in,
Dark ages.
86.
Where nobody got vaccines and everybody died.
Back in 86, I had surgery,
Mm-hmm.
and they found out I was,
Positive.
my blood,
Oh.
I was anemic.
Yeah.
So they had to give me 2 pints of blood. Well, then, right after that, I heard that there was a hepatitis in part of the blood.
That was
and
before they were
testing it all.
testing it, yeah. And that was probably B.
B.
Mhm. Yeah,
So
that was probably
and
B.
then I gave blood, probably a year or 2 after
Mhm.
that, and they test for it,
Yeah.
so I was okay.
Yeah.
But, for a year, I thought.
Yeah.
I might have gotten it.
Yeah, that was before they were testing blood for all of the different things that they do.
Well, then my one friend, she died from some kind of a hepatitis.
And hepatitis is one of those things. Hepatitis just means liver inflammation, infection.
Well,
So there's lots of things that will cause hepatitis.
she ended up with, liver cancer.
Mhm. Yeah.
But it was from the hepatitis, she
Mhm.
didn't drink or,
Yep.
you know,
Yep.
it just came along.
So if you are comfortable having those vaccine discussions, I think it's important to talk to your kids, grandkids, you know, let them know what these diseases look like, what can happen if their kids get them. Like I said, they're still here, we still see them, there's still a risk. Not all vaccines are carried by physicians. Vaccines are expensive. They require special kind of storage and handling. They can be kind of a pain to make sure that they're, you know, kept where they need to be, at temperatures they need to be, and monitored, and all of those types of things. So some physicians just will not have them in their office because they don't have the staff to do that, they don't have the, you know, the special refrigerators to do it, or they don't have, they don't go through enough to buy a whole box of whatever for, you know, $2,000 and use a dose and have to throw all the rest out. So, always talk to physicians about vaccines that you may need. If they don't offer them, find out if they, you know, if the doctors have an idea of where to go. Most of the pharmacies are offering pretty much any of the vaccines that you need. Pharmacies can give down to, I think right now it's age 7. So even some of our kids can get vaccines there. Some workplaces will do it if it's a, you know, possible workplace exposure. Currently at the health department, we are limited into the vaccines that we will do, just again, because of that cost factor and the amount that we actually give. So we have whooping cough vaccine, we have hepatitis A, we have hepatitis B. We do not carry the pneumonia vaccine, we don't carry the shingles vaccine. But Walmart has those, CVS has those, pretty much any of those chain pharmacies you can get those from. There is a lot of different information available online that's really bad, but then there are good information places. So always looking at CDC, they've always got the best information there. And then I really like this one right here, this immunize.org. They've got some really good information there, and I use that a lot with my families. These are just some different stories. I'm not gonna worry about those. So I did wanna just hit on COVID vaccine briefly. So right now, COVID vaccine is recommended for all people ages 5 and up. In the beginning, just because we didn't have the studies about mixing and matching, you weren't allowed to. Now, whatever vaccine you choose to get is fine, Pfizer, Moderna. They are not, as of this past month, they are really not recommending Johnson & Johnson anymore. Pfizer and Moderna are the ones that seem to be working the best. If you started with Pfizer and you get Moderna now, you know, they're also saying, hey, if you can mix and match them a little bit, that's good. It's the same technology, but they're a little bit different vaccines. I like to think of them like Pepsi and Coke. They're both colas, but they're definitely different. So, you know, mixing and matching is okay. The brand that you get is going to determine how many doses you need. It's also going to determine, or the age of the patient will help determine that a little bit, and then also about boosters. So right now, people could have anywhere from 2 to 3 in their initial series. Most people have 2, but if the severely immunocompromised would have had a 3rd dose, and then there may be 2 boosters on top of that. They are recommending that 2nd booster now to be administered 4 months after your 1st booster. Again, I think that's, you know, a conversation to have with your physician. I wish I had a magic ball and could, you know, tell you that, you know, it's gonna be, right now it's the same booster. I don't know if they're gonna come out with something different, kind of like the way the flu shot changes every year to what's circulating. We just don't know at this point. I think it'll probably be something that becomes like a flu shot, it's just kind of like a yearly thing. I wouldn't be surprised at some point if it's something that's mixed with our flu shot. I don't know. But definitely 2 doses, that first booster, and then, you know, that second booster they are recommending for, the older adults and those with some chronic disease.
Or had 4?
Yeah, so you would have had your 2 and 2.
Well, the third one was the spring,
Correct.
and then, was it 4 months after that, or what?
Yes,
What if it's beyond the 4 months?
it's fine.
It's okay.
Yep, absolutely. That's just kind of the minimum that we can do.
But if we're only gonna get them once a year,
They don't know that yet.
Yeah, we don't know that yet. I think that's what's been really hard. I mean, it's been hard for us in public health because we want to be able to give people good information. And I think we give people good information, but it's also, everything is just so up in the air during the whole pandemic. So, you know, we like to be very, yep, this is what we need to be doing. And we haven't been able to do that with COVID, unfortunately. So right now, it's 2 doses, 1 or 2 boosters, and
When everybody wants to point the finger
Wait
and
and
say what
see.
you said yesterday was wrong, no, it's evolved.
correct.
We've
What we said
evolved from
yesterday
this
was
today.
right
That's
yesterday,
right, and now we
but
have
today,
something
because
better.
we have more information, we now know, we now know more.
Right.
Correct. And it's hard for us to keep up. I mean, yeah. And that can be very frustrating too. Yeah. Any other questions from you guys?